my name is Meredith, and I'm going to be your nurse for the day. I've been ordered from your doctor to insert a Foley Catheter, and this will just help relieve some of the pain you have while voiding. So before we get started, can you just verify your name and date of birth? Alright, thank you. And do you have any allergies such as latex, iodine, betadine? What about to seafood or shellfish? Okay, perfect. We're gonna get started. Let me get some clean gloves. Alright, so this procedure will be slightly uncomfortable, but I'm gonna make it as comfortable as possible. If you do experience any large amounts of discomfort, just let me know. We'll stop the procedure and can restart it whenever you are ready. So to begin, I'm just going to roll back your sheets. And I'm going to place you into dorsal recumbent position. Just be on this side. And I'm just going to clean the perineal area. And to do this, I will just wipe from front to back, with each stroke changing the part of the washcloth I use. Okay, and then throw that away. Just place this between your feet. And I'm going to make this my trash bag. We'll just hold that for me. Okay, now I'm going to open it carefully. Careful not to go over my sterile field. Use my 1-inch margins. Okay, now I'm going to grab my gloves. And I'm just going to place this just under you with the shiny side down. So if you'll just lift up for me. And I'm just going to place this over you just to provide like a little more privacy. Let's place that right there. And I'm going to place my specimen cup just off to the side. And I'm going to open the betadine and spray it all over. And drop. And I will use this lubricant to help insert the catheter. I'll just a little bit right there, and drop. And I'll use 10 milliliters of water. I'm going to go ahead and hook that up. I'll place the tip of the catheter, just go ahead and place it in the lubricant it'll be right here. Whenever I get ready for it. Alright, so I'm going to clean the perineal area with the Betadine cotton balls. So I'm going to do one stroke and trash, one stroke and trash, and one stroke and trash. Alright, and this hand is also unsterile now, so I have to do everything with just this hand. And now I'm ready to insert the catheter, and I'll just ask you to breathe in deeply and exhale out, and while she exhales, I will insert the catheter. And I'll insert it until I see urine return, and then from there another 2 to 3 inches. Alright. And then I will insert the 10 cc's of water into the balloon. Okay, and then careful not to break sterility. Alright, and now I will pull back until I meet resistance, and resistance was met. And at this time, I will remove the bag, and I will fasten the catheter to her thigh and make sure to leave enough slack, just for like movement or anything. And I keep the catheter bag below the bladder to prevent backflow of urine into the bladder or anything. And I will attach the bag below the bed, careful not to attach it to the bed rails. Okay. And this time I'll go ahead and clean it up. And I can remove my sterile gloves. And I'm going to go ahead and move her back into a comfortable position. And I will also clean her perineal area just to remove any of the excess betadine or anything that was left over. And I'll cover her back up, and then to collect the specimen, I'll put on clean gloves. Okay, to collect the specimen, I will carefully, from the urine bag, collection bag, I will take this, remove it, and careful not to touch around it. I will fill it up and put this back in, and then from any time afterwards I need to collect urine, I will collect it from, I'm going to show you, I will collect it from this port just to keep it sterile. And I will lower the bed, and if the if the bed rails were lowered, I would raise those, but since they're not, I'm not going to. Alright, and at this time I would document that the Foley catheter was inserted without, the patient tolerated it well, there was light yellow urine was returned, the 10 milliliters of water was inserted into the balloon, and so now I'll leave, and then I'll come back and I have an order from the doctor to remove the catheter. So I'll come back in and I'll just introduce myself to the patient again and confirm their name and date of birth. So can you confirm your name and date of birth? Alright. So to remove the catheter, I will put on clean gloves. And before I remove it, I will empty the specimen bag and also take note of how much urine was in the bag for documentation. Okay, so I'm going to roll back the covers. And I will place her into dorsal recumbent position again. And I'm just going to get this towel just to place under her, so whenever I remove it, if any excess urine falls, the towel will catch it. And also I can wrap the catheter in the towel to dispose of it. Alright, to remove the catheter, I'll, like I said, first empty the drainage bag. I'll remove it from her leg, and I will take a clean syringe, and using positive pressure, the 10 milliliters of water will be taken out of the balloon. And it was taken out. So at this time, I will have her inhale deeply, and then as she exhales, I will carefully remove the catheter. And I will just wrap it in the towel that's below her. And I will dispose of it per hospital policy. And at this time, I will cover her back up, and I would clean the perineal area of any excess urine that might have come out during removal. And I will tell the patient to notify me the first time that she voids. It can take a couple hours, but I do need to know the first time she voids. And I'll lower the bed, and I'll leave her call light next to her just in case she needs anything. And I will document that she responded successfully to removal of catheter, and that I will document the amount of urine and the color that was withdrawn from the bag, and that I told her to notify me whenever she first voided.